sorry, this is like. So this is day 7 after we've done, well, it's not exactly a facial asymmetry surgery alone, but we've done surgery on multiple bones of his face to correct asymmetry and to augment his appearance and improve the proportions, along with the nose job. That's where you see the split of the nose. We'll explain one by one, just peeling this off, which is voted as one of the most painful procedures at the place. And I think patients' reactions, you can surely guess that what I'm saying is absolutely right. Yeah, this is actually soap now, and so, well, we still haven't found an easier way to remove this. The only easier way is not to apply this in the first place, but that's not a good idea because this really does a great job in the initial phase of healing. Okay, we're almost done now. This is just the last bit. Okay, one more shot and we're done. Okay, sorry about that, this is done. Okay, open your mouth. There's still some swelling, you can see from the bony work. It's just not even 7 days. But we've done work on his chin. He had a very large chin. We're going to go through that. This is not going to hurt so much, especially after you just go through pain much worse. So, okay, so you can hold this. And those we have it before. That's out. So you can show that. You keep it a little down. Now you can see. You can see. But so that others also can see. Okay, sorry, yeah. How does it look now? So see the tip from the earlier tip. I think the tip looks very beautiful. You agree? And then see the projection. Nice dorsal. We're going to show the side views. It's narrowed down. And we're going to show them also about the chin. So the face was a bit too long and the chin was a little bit deviated. Now it's much more in proportion. There's a lot of swelling, okay? But this is going to, because we also did work here, but that swelling will also come down. So what we've done is cheek contouring, angle osteoplasty, genioplasty with jaw sculpting, more work on this side, more swelling there, and then a nose job. So pretty much a face makeover, subtle improvements, not like a great improvement because you don't need that. Okay, so now we're going to show the side view. Can you look at that side? And see, this is the swelling. That's going to go down, it's going to go down. Look at the nose. So you can see the improvement. This was going up, now the angle is more better. So by de-rotating the nose, we've increased the length of the nose. So that's going to be more proportional for your face. And you can look this side also. Probably it's going to be less swelling on this side. So, right? Okay. Now, so the work, you see, has been done right from there. This is all swelling. So done work on the radix, some swelling there. And this is just some bruising, done a heal up. These stitches, we're going to take them off. That's the mark from the osteotomy. I've used a different color stitch there, so it's not that visible. And it's all going to go down like this. We're going to have a nice tip. His nose. This will take some time, more than the swelling from the nose to go down. And that's because we've done a lot of work on the bone, and probably will expect 6 weeks or something once all of that heals. So little bit diet control, because surgery both the jaws kind of malar bones. Wouldn't want to eat a lot of hard food. Sleep if you have on the straight or left side, right side no. take care of the nose. We give you some ointments, some tablets, take them. These switches will go off today.
Okay.
And if possible, I'll see you back again because you don't live very far away.
And what about Genioplasty, doctor? For me, actually, there is no screws, nothing like that.
Yeah, we will be taking a scan and going through everything also because we wait for the splints to be removed before we take the repeat scan for more clarity on the scan.
Actually, we did just
I know, but it's done before, so I checked that. We'll do it again when you come for review. Remind me.
okay.
Because subtle things, this thing obstructs. Even this comes on the scan.
Yeah.
The tape. I'll show you that. We make a covering thing.
Okay.
So we can take another one after a few days. So when you come back after a week or two, before you go abroad, come back.
Okay. So asymmetry, how it worked out actually?
It's worked out pretty well. I think you should be 95% symmetrical or more at the end of let's say 3 to 4 months.
4 months.
Yeah. And those, I think you should be 100% satisfied because no nasal asymmetry that you had was very minimal.
Yeah.
It was not a major asymmetry.
I had only mild here.
That was mild. We basically augmented the nose, improved the whole nose.
Yeah.
Not only corrected this thing.
Yeah, I'm happy.
You're happy? So thank you. That makes me also happy. I know it's hard to smile, poor guy.
Yeah.
Because it's all stitched up everywhere, outside, inside, bony work, and you're making a great effort to smile. But give it some good time of healing. And how severe was the pain here when you were there?
Actually, initially I was scared before the surgery.
We took rib also for you.
Yeah, but rib I didn't feel any pain actually.
Really? Awesome.
Yeah, really.
No pain for the rib?
Only 2 days when I hold here, I had a mild actually.
Mild, okay.
Only that's it. After
So
that,
where was your main discomfort?
my main discomfort was from the throat.
Throat.
I had, only the throat I had.
So the reason with the throat pain is because of the length of anesthesia. So when we are doing major procedure, what tends to happen is we give 5 hours anesthesia or sometimes 4 hours, 4.5 hours anesthesia. And the longer the anesthesia, the longer the tube is inside. So the anesthesiologist put a tube through which the gas is given, because of which the patient sleep or just go into deep sleep with anesthesia, general anesthesia. So that's the reason why some of them do have some pain in the throat. So not all of them again. There are a lot of patients, even after 4 to 5 hour surgery, say rib pains more or some doesn't pain much. So anyway, on a grade of 1 to 10, what was your pain score?
I can frankly speak only 2 or 3.
2 or 3? That's all. That's superb. So thank you.
Really, because this much big procedure.
Big procedure.
Big
That is
cut, bone cuts, everything.
Yes.
So all apart from all this, I got only 2 or 3.
And you can
And I
trust him
I
because he's also in the medical field.
Yeah.
So right. So that's nice. That's because of the pain medications. That's because of the way the surgery is done. And because of these compressive bandages also to a certain extent.
I
When
think
you remove it's a problem. But then immediately after surgery, just keeps everything together. The bone, the muscles, the skin all compact. So initial healing, swelling, it really works.
Actually, I felt because of the pressure, some discomfort because of the plasters, maybe I got little pain.
But not much.
But not much. It's
That's
very
good to hear. That's very,
much
very, very glad to know. So continue with all the medication that we give and come on over after 2 weeks or something before you go. Alright? Bye bye.